Not yet, but more people are being hospitalized, and that means more hospital beds are being used. Between that and staffing, some doctors and nurses in our area say that there is definitely cause for concern.
We nurses and healthcare providers that are in the direct care, we are exhausted.
But that's the least of the problems facing Temple nurse Maureen May. She works in the infant ICU, so her colleagues see a lot more of the COVID cases.
One good thing is that we are much more prepared PPE-wise. I don't know how long that will last.
Temple did not have an official spokesperson available tonight to talk numbers on available beds. Einstein, for one, says they've already begun rescheduling non-emergency procedures.
Hospitals have been diverting other beds to intensive care unit beds to take care of the load.
Pennsylvania's health secretary says hospitals are beginning to fill. On the state's COVID dashboard, Delaware County, for example, has less than 10% of adult ICU beds available. Montgomery County and Philadelphia have less than 20%. Dr. Levine says no hospital or area has hit the critical point where elective procedures must be cut back. But Maureen, who's also head of the nurses union, believes they should be.
That's where our challenge is competing values where we have elective procedures happening at the same time that we are dealing with the COVID surge.
Back in the spring, they were canceled. Montgomery County officials say there's no spare staff at their hospitals, and most are at or near capacity, already beginning to divert patients. But it really comes down to location. Mainline Health says there has been a noticeable jump in the number of patients, but the beds are there.
And our goal as a health system is to be able to care for those patients who come to our ER and are sick and need to have a bed and be admitted, and that's how we're functioning.
But I don't know if we anticipated the surge and the uptick to happen as rapidly as it did. But it is happening. Again, we are going to be boots on the ground and do the best we can.
And Maureen did say that she and her colleagues believe that at this moment there is enough bed space and more could be added, like for example the Leah Cora Center like we saw back in the spring, but that was barely used. Now, Dr. Levine said today that back in the spring we had the National Guard that was able to help. Right now they are tied up in long-term care facilities. There's not enough members to staff the hospitals. Live in North Philadelphia, Matt DeLucia, NBC10 News. Count on it.